NGOs left high and dry. The Woodside Sanctuary, which caters for mental health care patients in Auckland Park, just one of the facilities now in the red. It is owed hundreds of thousands of rand by the Gauteng Health Department in subsidies, and now it's becoming harder to cope with its 83 patients.
It's been an extremely trying time, I think, for non-profits and profits alike. The NGO sector is so reliant on funding for our survival, and we currently haven't received grants for the months of April or May in terms of our subsidy from mental health, which places us at a deficit of about 800,000 rand for those 2 months. And that's make and break for an NGO. It's the difference between the quality of food you can feed a child. It's the difference of whether you can pay your electricity bill, whether you can afford the medications needed for these children. It's the difference of having to let staff go.
The Ebenezer home in Witpoortjie in Johannesburg is in the same boat. It's afraid it may have to shut its doors. So it's a double blow for this mental health care facility. SABC News was not even allowed to enter the premises as 11 people, 9 patients and 2 staff members have tested positive for COVID-19. It's had no income since March and it's now owed over 168,000 rand.
The last time we were paid was the 18th of March, and that was for February and March. Since then, no money has been paid. We've been asking, and the department keeps saying, you'll get paid, you'll get paid. I am not blaming anybody, but I am blaming the system for putting us in this position. We are heading for another crisis, like when we had Life Esidimeni. There are NGOs that have got no food.
SABC News contacted the health department for an on-camera interview. We were told that the NEC was in an executive management meeting, and instead we received this voice note in which it concedes that the delays are unacceptable.
The department and the MEC for Health, Dr. Namathemba Mokheti, takes this matter very seriously and concedes that the delays are totally unacceptable. The MEC has been informed that there were delays in the approval of revised service level agreements with NGOs, which has resulted in the delays in the processing of payments. The management of the department has given an assurance that special payment runs are already being processed to ensure that outstanding payments to the NGOs are effected as a matter of urgency.
It is very unfortunate that after the Esidimeni tragedy, mental health patients in more than 100 NGOs, and there's thousands of these patients, have still not received their subsidy from the Gauteng Department of Health. The NGOs are on a terrible crisis. Some of them don't have food to give to their patients, and they're not able to pay staff.
The Human Rights Commission says it will investigate the matter.
Decision-making when it comes to matters that affect the vulnerable is very important. The Gauteng government was warned prior to the Life Esidimeni. Decisions were taken which violated the rights, or the impact of those decisions violated the rights of mental health care users in Gauteng. And we are seeing a repeat where the government does not plan properly to fund NGOs sufficiently and to ensure that the funding is not interrupted. As we speak, some of these NGOs are running a deficit, which was not caused or occasioned by themselves, but it is something that stems from what government has done, and this is quite disappointing.
The SABC reached out to other NGOs in similar dire situations. They told us they were too scared to speak out, fearing being targeted. Crisalda Lewis, SABC News in Johannesburg.